Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. It's October the 16th, and we'll do another Facebook Live. This is a chance for you to ask questions, and we'll try as best we can to answer them. As always, I start off with a mask. This is one my wife made, and I'm going to take it off here. It's got one of these little plastic things in here so it doesn't stick to your face as much. That's kind of nice, but I'll see over time how it works. Anyway, for people who are reading lips, Bob Dannenhoffer, the Public Health Officer from Douglas County. It's October the 16th. So if you have questions, put them in the chat section. We'll try and answer as many as we can. The ones I don't get to tonight, we'll be able to do later on. So as we always do, we start off with the world situation, 40 million cases. So, back early on with China when we were in the 80,000, I don't think anyone really thought we would get over more than a few million. At 40 million, this is a very, very active pandemic. In the world, about 1.1 million deaths. And today it looks like we're going to be hitting 400,000 cases in a single day. That is just stunning. Still very active in India, US, and Brazil, pretty much all of South America, especially Argentina and Chile. Now, Argentina and Chile are in the temperate zones in South America. They're just coming off their winter, and the thought was that as their winter was ending, that the number of cases would really go down, but still they're having a tremendous number of cases. And Europe, which had been pretty quiet, is now seeing a huge outbreak in France, Spain, and Italy. But there's still some places that are doing great. I mean, you look at Taiwan, New Zealand, Australia, South Korea, they really have kept this disease very, very low. And people will say, well, maybe they're not reporting it. No, I will tell you, Australia and New Zealand are pretty much trustworthy countries, and they're really doing a lot of testing and not finding much disease. In the US, we're at 8.2 million cases and 222,000 deaths. And the thought was that we would not hit 225,000 deaths until November. It looks like we'll hit 225,000 deaths this weekend. Still really active in California, Texas, and Florida, but now so many places. There were 26 states yesterday that had over 1,000 cases. So pretty much every big state had more than 1,000 cases in a day. Oregon has 39,000 cases, 617 deaths. Very clearly, when you look at the Oregon number, we're clearly in a third peak. And this is pretty much around the state. There's almost nowhere in the state which is free from disease. And Lane County, just to our north, just got added to the watch list today. They've had a lot of cases, especially cases related to college or near college activities. So again, we don't think kids are going to class and getting this in class. We think they're getting this in off-campus activities or when they go to work. So lots of cases in Lane County, really not very far from us. In Douglas County, we've had a tough week. We had 5 cases today, and then they told me just another one tonight. We've had 26 cases over the last 7 days, and it's really scattered. During the summertime when we had our peak, there were a bunch of big outbreaks, but now it's really scattered with travel, gatherings, and again, these social gatherings are really a big deal, and then work. We're starting to see this spread at work, and interestingly, it's usually spreading among workers rather than between workers and clients or workers and patients. We haven't seen much of that. It's usually among workers themselves, probably not surprisingly. When I go in a room with a mask on, I'm not likely to give it or get it from a patient, but then later on, if we go to the break room or later we go to the room where we talk about a case, we may be a little less careful. So we want people to be really careful about those things. We have 4 in the hospital. We have 41 in isolation. That's a lot of people in isolation. 129 in quarantine, including 63 kids. So there's really, really a lot of disease going on here, and we're really at that time where this could just continue to shoot up. You remember we talked about Israel a few weeks ago that sort of followed the US pattern, and they took their third peak, started, and then got super steep. And that's the concern we have in the US, that our third wave is going to be really steep, and then it's going to happen in late October and November. So please be careful. So a couple of things. We have the Binax Now kits. And so I brought one with me, a box with me. There's 40 kits in a box. These were purchased with CARES funding and distributed to the states and distributed to the counties. So we have them now and have distributed them already to 11 clinics in the county, and we'll distribute them to more so that basically all of the primary care people can do it. Let me ask Brian to see if he can pan down. We're actually going to do one here for you to show what it's like. So unlike the other tests where you have to, go deep in the nose, this one just goes in the front of the nose. Well, I'm not going to do that here, but each of the boxes comes with what's called a positive control. That's one that you know is positive, and we'll show you how that works. So the kits come like this. They're like little cards about the size of a credit card. You open it up. This is the positive control. So this is one that should be positive. So we'll work on this, and if we get a positive result, that's as expected, but you'll see how it works. It's really pretty simple. Even I can do it. So what we do here is put some drops of fluid in here. I think I did that right. And then we take the swab. Now, typically, if we were doing this on a person, we would do the swab just in the front part of the nose, no more than 1 inch. You do each side. Somebody did mine yesterday just to see what it would be like. It was uncomfortable, but not terrible. It then goes in a little slot here. We then twist it 1, 2, 3 times clockwise. Not exactly clear why it has to be clockwise, but that's what they say. And then we close it up. As you can see, it's got a little blue line there now, and in the next 15 minutes, so at 6:22, we'll read it again, and we'll see what the result is then. Okay, so that was it. Very easy to do, not at all complicated, and because these were distributed by CARES funding, they are free to the clinic. So this is going to be great, because now when you come to the clinic with symptoms, and you say, well, is this COVID or not? And the answer in the past was, well, we could do this difficult and complicated, expensive test. Now what we can do is we can do this quick test and get the results fairly quickly. So this is going to be great. Okay. So Jeffrey says, with the daily counts getting higher, are any of these workplace outbreaks? The answer is yes. Several of these are workplace outbreaks. We think we have 9 current outbreaks, some of which have been reported, one at Umpqua Valley Rehab. There's one at the hospital, but that's pretty much ending. There's been some at other small workplaces. No big workplaces like we'd had in the past, but just lots of little workplaces. And that's what's happening. And again, people, when they go to work, tend to gather at work, and we think that's how this is spreading. So how many cases can we have for upper grades to start? Too many for November opening, Veronica wonders. Well, so you'll remember that Oregon was one of the very first places in the country to come with opening metrics, and I was deeply involved in that, and we came in very conservative. I was on a call today, and we may open those up a little bit, but currently to open up for 412, you need to be less than 10 cases per 100,000. So for us, that would be less than 11 cases for 3 weeks straight. I don't see that happening again for quite a long time. The places that are open can stay open. So November opening doesn't look likely. So Debbie says, I hear the flu shot can make you sick. Is there any truth to this? Well, I already got my flu shot. We did flu shots today for 127 people who went through the drive-through. Very clearly, with the flu shot, you can get a little bit of achiness and a little bit of fever. There are some people who say they get the flu from the flu shot. That does not ever happen. But there are some people who do feel achy for a day or two. However, when I have specifically interviewed and they say, oh, I got the flu, well, so tell me, how high was your temperature, what you did, how many days of work did you miss? A lot of people say I was kind of really achy the next day, but I didn't miss any work, or I missed 1 day of work. I will tell you, if you get the real flu, There's nobody who misses less than 3 days of work. I've only missed about 10 days of work in the last 40 years, and half of those have been with the flu. So anybody who says they got the flu from a flu shot, I'd love to talk with them and find out just what they'd had. Almost no one has had the same kind of symptoms you get from the flu. And so I had my flu shot about 10 days ago. It's great. Okay, let's go through some other interesting things. Last time, somebody said, well, this Daily Citizen said, well, the CDC study showed that people who wore masks and didn't wear masks both got COVID, so why should I wear masks? That is clearly not what the CDC was getting at. What they did was what's called a case control study. So they find people who tested positive for COVID. And then they found similar age and sex and race people who were in the clinic and didn't have COVID. And then they compare them and they ask them questions like how many restaurants you went to, how many bars did you go to, how much mask wearing did you do. The mask wearing was actually lower in the people who got COVID. Not that much lower, but the people who got COVID were much likely to go to restaurants, much more likely to go to bars, and much more likely to go to places where they said other people weren't wearing masks. So that was what really came of the survey. It really didn't comment at all about whether masks worked or not. And again, if you went to restaurants or bars, you were probably not wearing your mask in the restaurant or bar, and so that was likely the issue. Somebody asked about animals. There's been a lot of this in mink. So mink, these weasel-like characters that people raise in large farms, and apparently it spreads very well among mink. And so there have been a lot of losses of mink at mink farms because of coronavirus. Whether people gave it to the mink or the mink gave it to the people or neither, we really don't know the answer. But it was really quite shocking, the number of mink who got ill. As I said, we did our flu shot clinic today. It was great. I think most people only waited in line just a few minutes. We have plenty of flu shots, so we did them today. We're going to do them again from 10 to 2 on October 30th. And we're going to do it from 10 to 2 on Veterans Day, which is November 11th. Easy, quick. The flu shots this year seem to be a good match for the virus that's around. Although in Australia and New Zealand, they haven't had much flu. So usually we look at Australia to be a predictor of what's going to happen to us. They did not have much flu, we think, because they have done such a good job with masking. As always, we talk about vaccines. This has been a bad week for vaccines. The two of the vaccines, the AstraZeneca and the Johnson & Johnson vaccine, have both paused their trials, which means that they're not giving it to anybody new, and they're looking at the data because of some adverse effects of people who got the vaccine. They haven't told us much more about it, so we just know that they're paused. But every day they're paused is a day that's later that they could ever get approval. There are still two vaccines, the mRNA vaccines, which are still going. We do not have any idea whether they're working. We do know that there are many side effects, but we don't know if they're working. Okay, one more questions here. So how accurate are the new tests? Well, it turns out that they're not quite as good as the PCR test, but a recent study was done at University of California in San Francisco where when people were seen, they did both tests. They were pretty accurate, well above 90% for sensitivity and specificity. So for what we would be using them for, which would be mildly symptomatic people, really quite good. We're not to 622 yet, but this one worked perfectly. Yeah, Kat says, what about the quote from the president that about 85% of people who wear masks get COVID? What a dope. I mean, what else could you say? I mean, he's got the world's best briefers, and yet it was not true. So he got it backwards, but was still wrong. So what they found was that of people in this case control study, that of the people who got COVID, 70% said that they wore masks all the time, and 10 or 15% some of the time. That's where they got the 85%. The number was about 89% in the people who didn't get COVID, but that doesn't mean anything about the effectiveness of masks. And the CDC was very clear in their article. So that the fact that he's got the world's best briefers and still comes up with this stuff is just Just crazy. Okay, so Zach says, what is the criteria to be considered an outbreak? And it's different in different places. So there are outbreaks and then reportable outbreaks. So reportable outbreaks, you have to have a certain number of cases in a certain size business. For an outbreaks in schools, we consider 2 cases. In a nursing home, we consider 1 case. So it is a little bit confusing. But outbreaks are really where you can actually pin together a place where there's more than 1 case. How accurate are the new tests? Pretty accurate. Okay, we're not to 622 yet, but this is looking good. Okay, a couple of other things. One was the final study came out about remdesivir. And so remdesivir is this antiviral drug that was first developed to treat Ebola. Did not work very well for Ebola, but seems to have some effectiveness for COVID. What it showed was that the people who got this had spent less time in the hospital and less time in the ICU, which is great. And they seemed to have a lower mortality rate, although statistically it wasn't significant. They seemed to have a lower mortality rate. So it looks like this is pretty good. Is it great? No. Is it a cure? No. Is it a home run? No. But as we've said before, for you baseball players, it's a bunt single. You'll take that every day, but it really doesn't change the world. Okay, what else do we have here? So Christy says, what's the best mask for my 6th and 7th graders to wear to school? The one they will wear. So really with masks, the very best one is the one that you will wear. And so we would like people to try to get the ones that they're going to object to the least and leave on their face. Because if you get the world's best mask, but they're always pulling it down, it's not going to work very well. So the one that you wear would be best. I actually had a little discussion with somebody today, is whatever you can wear, whatever you can leave on your face, that's the one you should use. Now, ideally, you'd like one that would be at least 2 layers. Ideally, you'd like to have one that very much covered your nose and your mouth. And you might also want to think about wearing glasses. Interesting study from China looked at people who got admitted to the hospital. About 6% of the people who got admitted to the hospital wore glasses on a regular basis. However, about 32% of the people in China wear glasses. So it looked like if you wore glasses, you were much less likely to get admitted. I don't know if that's true or not, but it was interesting. Again, your eyes are these moist surfaces that pick up a lot of germs. And it may well be that that tiny bits of virus get into your eyes. You know, your eyes are connected to your nose. So germs that get in your eyes get into this respiratory stuff. The tears then in your eyes go through a little duct between the corner of your eye and into your nose. So it's a way to introduce virus into your nose. So it was interesting. So since I wear glasses, that's good. You might also consider, if you were wearing glasses or contacts, you might want to do glasses. Maybe they'll be stylish these days. Yeah, so Debbie says, have I read the study results on COVID and blood type associations? So early on, there was a suggestion that blood type either influenced the amount of disease you got or how sick you got. There have been 5 separate studies that have found slightly different things. It may have a slight effect, but since blood type is something you obviously have no ability to change at all, it's kind of interesting, but doesn't really tell you what to do. So how many cases have we had in school so far? So we've had 1 case in Sutherland. There was 1 first grader in Sutherland who got this from his family. There were 2 other people in the class who were sick, but it turned out that they did not test positive for COVID. And then we had 1 down in South Umpqua, a high schooler, who had a positive test. And again, we don't think there were any secondary cases. So again, this is kind of what we thought would happen at schools, is that if there was enough disease in the community, you'd have cases among kids, because kids live at home with their parents who are sick. But that we weren't that worried that it would spread widely at school, and that's what we've seen, but only 2 cases so far. We talked with the state epidemiologist today, and that's what they found too, is that there have not been big spreads at school. All right. So Allison says, if a teacher misses work because they are sick, but not with a fever, should they have a COVID test before returning? So people who work with kids or people who work in healthcare, the story is you shouldn't go back to work if you have any symptoms. So if I have any symptoms, I should stay home until my symptoms resolve. Turns out that the symptoms of COVID are pretty varied. Not everybody has a fever, not everybody has a cough. We had one person definitely had COVID, all they had was diarrhea. We have some people who only have abdominal pain. So you might want to consider, now that we have a simple, quick test, you may want to decide when you are sick to go to the doctor, get this test, and see what the results are. The other thing I heard today was somebody said, well, I heard that CDC study that only 6% of the people who died had only COVID. And what I said to them was those 6 death certificates were probably the ones that were done sloppily or inaccurately. So this is a car guy that I was talking to. So imagine that you get into a car wreck, you run into an embankment, and you die. The cause of death is not, the only thing on your death certificate should not be just car wreck, right, or car accident or motor vehicle accident, because your cause of death is going to be massive head trauma, blood loss, aortic disruption, all of those secondary to COVID. In that case, by the CDC report, which was again terribly misinterpreted by our president, it did not mean that it would say that, oh, they didn't really die of the car accident, they died of this head trauma. Well, this is the way death certificates go. It's head trauma, secondary to motor vehicle accident, massive blood loss or aortic rupture, secondary to rapid deceleration, secondary to car accident. So with COVID, it's not the COVID itself that kills you. Right? COVID doesn't get into your bloodstream. COVID itself doesn't kill you, but it's acute respiratory distress syndrome caused by COVID. So it should be acute respiratory distress syndrome secondary COVID, or kidney failure secondary COVID, or clot to the brain caused by COVID. And in those cases, it would look like there's other kinds of secondary conditions, but that's the way they should be done. If anybody would write that one, just write COVID-19, what happens then is the medical examiner comes in and says, well, you need to fill it out a little bit more accurately, and then you'd have to write massive head trauma secondary to motor vehicle accident. Similarly, if I just write COVID, they'd say, well, that doesn't exactly tell us. Did they have a cardiac rupture? Did they have myocarditis? Did they have ARDS? Did they have a brain bleed? What did they have that caused COVID? So again, this is something that was terribly misinterpreted. And again, if you read the original studies, and I always do, so when they come to this, I don't read the news reports, that's just silly. I read actually the CDC reports on the CDC survey. I actually read the CDC survey rather than this thing from Daily Citizen. I mean, there's a lot of information out there, and I'm not impugning any motives here, but the idea that you could actually find out the real answer and then come up with this crazy stuff just is crazy. Anyway, so we're over 15 minutes, so you can read this. And I think what you can see here is that this is 2 lines. The blue line that was there before is gone, and now it's got 2 red lines, which means this is positive. Since this red stick here is the positive control, it's supposed to be positive, so this worked exactly as it did. So you can see, really easy, really simple. They can be done anywhere, and so we're really encouraging offices to use these. Again, they're distributed free to the offices. The only requirement is that they don't charge you for them and that they record the results. Okay, what other questions have we got? Yeah, so, the trouble, this is about ventilation in schools, and I had another conference about this today. We really think that good ventilation makes a difference. There was an article that came out yesterday about airplanes. So airplanes have incredible air handling. So in airplanes, they take in air from the outside, it goes through HEPA filters, it gets washed out, and then new air comes in. So they have about 15 air changes per hour, unlike many homes that have less than 1 air change per hour. And again, we think the more air changes you have, the better. Now, being outside, you have lots and lots of air changes. So being outside is the safest thing to do. In schools, again, I've asked them to calculate the number of air changes, and if they have a low number of air changes, to think about ways to increase ventilation in the rooms. So Denise says, should all elderly get a high-dose flu shot or just high-risk people? So we know that older people tend to make a less vigorous response to the flu vaccine. So they've come up with a regular dose flu vaccine and then a high-dose flu vaccine, which is just like the other one, but just more of it. And people do statistically have a better response to it. However, it's not that much different. And what the CDC and ACIP recommends is to get the flu shot that's in front of you. So I'd have you talk to your doctor. Some of the doctors who take care of lots of older people recommend you only get the high dose. My recommendation is everybody should get at least one kind of the vaccine. At our drive-through, we have the regular dose vaccine. And again, it would be far better to get the regular dose vaccine than none at all. Yeah. So Amy says, why is it taking so long for this multisystem inflammatory disease to be recognized in adults? We don't know. This multisystem inflammatory disease, in the past, it's a lot like Kawasaki disease, which is almost always a disease of kids. And it may be something unusual about kids early on where they have this super inflammatory response. Now, we're starting to see we're starting to see some of it in teens. There's one case in an adult, but it may be about the way kids react to viruses. But again, we don't really know what's going on there. Yeah. So Anna says, when will second grade get shut down at 30 per 100,000 for 2 Mondays in a row? So again, another conference I was on today, we were talking about the Oregon rules. So Oregon was the first state to come up with opening rules. And since we were the first state to do it, that was kind of uncharted territory, and we came up with very cautious guidelines. Since then, other states actually have borrowed from Oregon's, and they've used ours and they've been less cautious. So California, Washington, and now the CDC came out with guidelines that are less cautious. So we may change the guidelines in Oregon over the next few weeks. Don't know for sure, but we would. But as they sit now, if we were more than 30 per 100,000 for 2 weeks in a row, then all schools would need to close in Douglas County. We're hoping we're not going to get there. We weren't there last week. I give it about 50-50 for this week, depending on what's happening. Yeah, Robin says, my folks are in their 80s and sheltering. Will it be 2022 before I can safely visit them? I hope not. I hope not. My mom is 90, and I saw her in January and not since. I think when the disease gets to a very low level, you'll be able to do that. When we're going to get there, don't know. I was listening to an interview with Dr. Fauci today. He thinks sometime in not before mid-2021, and hopefully at the second part of 2021. But to do that, it's going to take, I think, 5 things to work right. The first is the vaccines are going to have to come out and they're going to have to work and be safe, and people will take them. So the vaccines clearly got to be part of it. I think second is that people are going to continue to have to do just stuff which is just unpleasant. Masks, I hate masks, but we have to do it. Social distancing, not being in big gatherings, not having everybody over for Thanksgiving, not going to big parties for Super Bowl and for that. The third thing it's going to take is that if we get a really effective treatment, so if these monoclonal antibodies really do work, fortunately this week, Eli Lilly, which is the one that's making the most of this, they're making a single monoclonal antibody with a company in Canada. They had a pause this week too, and that's worrisome. And the total amount that Regeneron has made is 51,000 doses, which is a lot of doses. But we had 60,000 cases yesterday. So if we gave this 51,000 doses to everybody who was sick with the disease, even people who were moderately sick with the disease, we'd run out in a week. So, but we're hoping, that we'd get a good hit there. We're hoping that people will recognize that this is going to be a tough time and really do other kinds of things so that by next summer things will be better. but I don't know when. So people ask me to predict, and I'm actually doing a talk on Monday with Chamber of Commerce that people may want to listen to. And the last slide is about predictions and how difficult predictions are, especially about the future. Okay, so is that Annie or Amy? Name. Amy. Yeah, so Amy says, what is isolation and what is quarantine? So isolation is somebody actually has the disease. You want to put them in a place where they're not going to give it to anyone else. Quarantine means somebody's been exposed to the disease and you want to keep them away from other people so that they won't give it to anybody else. In reality, isolation and quarantine are very similar. It means you should be ideally in a room by yourself. It means that you shouldn't be gathering with others. You should use the toilet. If you had your own toilet, would be great, but if not, you should use it only by yourself. That your meals should get delivered to the door. So it kind of means you're like in your room for 10 or 14 days. Really hard for people to do, for some people who just need to get out. But that's the difference between isolation and quarantine. Isolation for people who have the disease, quarantine for people who have been exposed to the disease. And quarantina comes from a word meaning 40 days, which was the amount of times that ships would be quarantined to prevent disease from coming into port. Yeah, so Veronica says, I get upset seeing people with a mask over their mouths and not their nose. Yeah, I do too. And I get a little upset with these little face shields that are like about this big. They're not preventing much disease. But again, they're doing something, right? The thing that really gets me is people who go without masks totally and then get totally irate when somebody mentions it. That's the thing that gets me. The people who are doing it imperfectly, do it better. We could all do a little bit better. I mean, I could do better too. And so what we have to recognize is that the biggest effect in the world comes from people doing things better rather than everybody doing things perfectly. So this happens all the time in pediatrics. So he says, well, I'm out of shape, but I could never run a marathon. And the answer is, you don't have to run a marathon. But if you go from being on the couch and never exercising to walking a couple of times a week, that's a big improvement, and there's a tremendous improvement there. If you're walking a few times a week, walking every day is better. If you're walking every day, maybe putting in some higher activity like playing basketball or running. If you're doing that, doing a little bit more. But everybody doesn't have to be a marathon runner. You just need to move to improve. So this person's already wearing a mask, which is pretty good. Next thing to do is put it over the nose when you're around other people. Yeah. So if somebody has antibodies and are recovered, does that mean that they can't infect someone? We think so. So we think that if you've recovered and you have antibodies, that at least for some period of time, that you will not be infectious. And in fact, that was, you remember there was a very dark time in March and April where we thought we were going to run out of N95 masks. And the thought was if you were in that group, you could work without wearing an N95 mask because you would no longer be contagious or could get it. It was a pretty rough time to think that that's how we would deal with this. So we think that's the case, but we're not sure. Remember, there are a couple of cases where people have gotten it again, and we know they've gotten it again because it's a different virus. And then hundreds of cases where people have said they got it again, but they didn't actually capture the virus the first time, so they can't really know if it's a different virus or just a continuation of the last. But yes, if you've had it and you have antibodies, you're probably at the lowest risk for spreading the disease. Now, we don't know how long the antibody is going to last, and we don't know how long the protection is going to last. Now, with most respiratory viruses, it doesn't last very long. Unlike bloodborne viruses, where it lasts a long time, measles immunity lasts a very long time. Things that don't actually get into the bloodstream, you don't make good immunity to. So norovirus, which gets into the gut but not into the bloodstream, you don't make very good antibodies, and that's why people get it again and again. Similarly, diseases that are mostly in the respiratory tract, like flu or like respiratory syncytial virus, you don't make great antibodies to. And that's going to be the worry with this one, that you may have some antibodies in your blood, which is interesting. But the question is, do antibodies in your blood prevent it from attacking your nose? And we don't know the answer to that. Yeah, is there anything known about how COVID affects a pregnant mom and the baby? Well, we definitely know that moms can get this while pregnant and can pass it on to their babies. And some moms have gotten very, very sick while they've had this and then been in ICU and whatever, had to deliver their babies by C-section. There was a recent report that statistically women who are pregnant when they get this tend to have a worse time. And again, that wouldn't be shocking. Remember, we think obesity is an issue because it sort of constricts your lungs. Not surprising that COVID, that having a baby and having that baby kicking up at your diaphragm all the time might also constrict your lungs a little bit. So definitely a risky time to get COVID. So places have signs stating that masks are required. Why are they letting people in? And so I've talked to people about that. Why aren't you stopping them and say, look, our customers, these are our customers. We don't ever want to be fighting with our customers, and we don't want to be the mask police. And it's hard to blame someone. I've seen some of these videos where somebody tells somebody about wearing a mask and they get into a fist fight or get thrown to the floor or whatever. And I think people are trying to avoid that. And again, I hate this kind of confrontation. I really don't like to yell at people about their traffic thing or about what they're wearing or about wearing masks or whatever. And I think businesses are reluctant to become the enforcers of that. I know people in the county, the sheriff in the county, has not been anxious to go ahead and be the enforcers of mask stuff. So for businesses, OSHA is the enforcer, sort of their job, and so that's what they do. So if you have questions, those are the people to go to. All right, a couple of other things. Herd immunity all in the news this week. So herd immunity means let the disease move through the community so that there are enough people who've got it so that it won't spread anymore in the community. And so herd immunity comes from animals, where if there's enough animals in the herd that are immune to something, it won't spread around. And this is a reasonable strategy at a time when there's no hope for a virus, there's no hope for treatment or cure, and there's not much else you can do. So, that's sort of what we did for measles back in the 50s. There was no hope for a vaccine because we didn't know how to make attenuated viral vaccines. There was no special treatment for the measles, and we recognized that there was no way to kind of keep it in check. So you let measles go through the community. Again, it was mostly young kids who would get it because it was so contagious. They would get it, and 1 in 1,000 would die. So that's a lot. That would mean in Douglas County, every year there'd be 1 or 2 kids who would die of the measles. For every kid who died of the measles, there were 20 or 30 who were miserably sick for weeks or months. So measles was really a dreaded thing in the time. When the vaccine came out, the idea of doing herd immunity was just craziness, and people then moved to get the vaccine, and now measles kills almost no one in the United States. So yes, herd immunity is not an unreasonable strategy when there's no other hope, but when there's other hope, it doesn't make much sense to me. Because if we were going to do a herd immunity strategy, meaning that you wouldn't have any other restrictions, you just kind of let it go through, we would have every day 30 people in the hospital with COVID. We would, like many of the other places that have done less restrictions, we'd have hundreds of deaths over the next few years from COVID. And if that's okay, then that's okay. So again, remember, public health doesn't get to make public policy. Public health is like the weatherman. We tell you what the weather is, and then we let politicians make the decision balancing things. And sometimes the balances are tough. Do you let bars open till 9 o'clock or 10 o'clock? Do you close gyms? How do you do those things? So they're really complicated decisions in the middle. But this decision would be, we're not going to have any restrictions. We're just going to kind of let it go. And that would be foolish because there are some good vaccines, I think, on the horizon. There are some good treatments, I think, on the horizon, but you have to let these companies get to the place where they can make more of it so that rather than having enough doses of Regeneron for a week, you'd have enough doses of Regeneron for anybody who needed it. So, my analogy to this is herd immunity is, I'm the weatherman, I say there's going to be a big hurricane tomorrow. It's going to be a Category 4 hurricane that's coming onto your shore here. You've got to make the decision whether you want to take out your small sailboat. And it's up to you, right? I'm not going to tell you as a weatherman, don't take out your small sailboat. But it would be, I think, really foolish to do it because you could wait a few days when the storm was gone. You could take it out a different day. You don't have to do your sailboat that day. So similarly, the decision to pursue herd immunity, I think, is foolish. And I think the weatherman might say to the guy taking a sailboat out there, that's foolish, but it's the weatherman is not going to be the one to stop them. And there's a story about me taking out a sailboat in a hurricane that I'm sure my brothers and sisters who are watching this are just cracking up about. But someday I'll tell you that story. Okay, let's see if we have anything else. I think we've covered almost everything here. What I do want to tell people is that it's really important this year to get a flu vaccine. We're doing them again on October the 30th, the day before Halloween, from 10 to 2 at the fairgrounds. And then again on November 11th between 10 and 2. The vaccines are no cost to you. Now, obviously, they're a cost to somebody, but the federal government, through the CARES money, bought the flu vaccine, gave them to the state, and the state gave them to us. And the other parts of it, the vaccines, the labor, and whatever, have been donated. Of the material of the vaccines have been donated, so there's no charge to you. Again, I got mine, barely felt it, had no side effects later on. But again, it's really important this year to get these, because if people have fever and cough from flu and COVID, and especially if they get it together, it's going to be so complicated for us to figure out what goes on. The other thing is we still have our $50 bill to anyone who can show me of somebody who died with COVID, but not really from COVID. And again, these should be from Oregon because I can look at Oregon death certificates. So somebody from Oregon who really didn't die from COVID, they really died in a train wreck or something and they just called it COVID, or they died of COVID and they didn't really have it. Again, $50, anybody can show me. Again, I've had a bunch of people say, oh yeah, it happened to my friend. They were in a car wreck and they did this. And then the answer is, well, just tell me where and when the car wreck was and I can look it up. And they haven't been able to do that, suggesting that it may not be a real story. Now, I'm not saying that people are lying, but what we're seeing is stories that are passing from friend to friend to friend to friend to friend. And when you try and dig deep to, okay, tell me exactly where and when this happened, you're going to do it. So $50 for that. Second thing we're doing is still if you're a governor for a day. So again, we have a lot of people who rail at, we should do something different. But doing something different is not really the right answer. It's like, what specifically would you do? Like open schools regardless of what the rate was in the community. That would be reasonable. What you'd say, well, is we could open schools if we close bars. That might be reasonable. That it makes no sense to open up Pac-12 football while we can't open up K3. We should open up K3 preferentially. When that works, then we should open up football. So I don't know what the right answer is, but if you want to be governor for a day, please go ahead and do that. And the next one was another $50 for the person. Again, I keep seeing this of people saying, oh, I went for tests, I never got the test, and yet I got a positive test result. There was one group of errors in Connecticut, small group of people, and it was an error. But there have been no cases of this in Oregon, and yet people tell me it's happening all the time. Again, if you find it, that $50 is yours. Okay, that's what we got. All right, well, thank you. It's 6:44. This test is still positive. It's going to be a great test. And again, it's called the Binax, and we're going to hopefully distribute them to all of the places in town. We got 1,000 of them last week. We're supposed to get 5,000 of them this week, and so there should be plenty to go around. All right, again, this is Dr. Bob Dannenhoffer, the Public Health Officer in Douglas County. Thank you, and please be kind.